I'll allow you just to look at the screen. It's just going to be straightforward. What the SAGES Outcome Initiative will help us not only track patients, but actually will let us know as surgeons where we're standing when we compare ourselves with the rest of the surgical community. For example, myself, as a bariatric surgeon, I do my case. I like to know whether I'm standing with my outcomes. And I think that's a very powerful tool. It's still in progress. And I'd like to share with you a first look. So then again, we're in our PDA. Just go to the programs. We'll take you to this screen. You scroll down until you identify these logo satellite forms. You tap on it, and you have this screen here. You do or you don't? Okay, everybody's with me? All right. You double click or you tap on SAGES Outcome here. That will bring out the database already preloaded in your secure digital card. Everybody has any problems bringing this screen up? I'm going to wait. Again, the concept is very similar. This uses a database engine in the background that will collect this data while you're inputting regarding your practice, and then we'll dump it into a bigger database so queries can be run and conclusions can be hopefully made. Is everybody seeing this on their pocket PC? Not yet? Okay, we'll wait a few seconds. And again, this is a work in progress. I think in very soon.
We got to put your cards back in.
Very soon, this will be.
Make sure your SD cards are in because the database is on the SD card.
If it doesn't bring it up, Steve, you can probably take the SD card and
Yeah, the cards back in.
put it back in. Yeah. All right, we're all set. Okay. Now I'm going to start a new case. We just finished a case, and we'd like to input it into this database. It's nothing else but a database. So we start putting our ID number, date of surgery. You can scroll down. It will allow you to pick up the month, the date, of course, the year. Just do it with me, and just you can come up with some numbers here. Then you go to the ASA classification, work status. It's very, very straightforward, very easy, very intuitive. Doesn't require any knowledge, but I just invite you just to go ahead and play with it by filling out some of these blanks. When it comes to primary diagnosis, unlike Dan's database where you have a scroll down menu, on this particular one you have to input it. So you can just, let's say we already know the number. I think future versions will help you, assist you with a drop-down menu, just identifying easier your diagnosis. But then again, just play with the numbers.
The other problem on the disease is when you're actually trying to enter data on the lower part of your field, the typewriter obscures that.
Yes. It's nothing different that you have been experienced before. You just double click on this, and automatically you can just punch your numbers here. Or if the square happens to be in the bottom part, then you have to kind of scroll down and automatically you'll see we don't have nothing to fill out here, but let's say that this square here, this box in the bottom, what you need to do is just scroll it down. I just took advantage of the keyboard of the computer just to do it a little faster. But I'll go with you. Then again, secondary procedure CPT, I can't come up with anything. So again, just put some numbers there. You decide whether it's an emergency procedure or not. Then you click on anesthesia. Again, very straightforward. If the keyboard is not needed at this point, you just click the keyboard again. So it goes away from your screen. You go to the next screen by clicking on page down menu here. Invite you again just to fill the blanks with me. We continue. Then again here, let me bring this up again and just fill out the squares. I think again, future versions will prompt you with a drop-down menu here where you can input the data without the need of a keyboard. When it gets to registry, the program will ask you what kind of procedure you have done. Was either morbid obesity procedure or gallbladder procedure. Let's check gallbladder. And tap on continue. Depends on what you have picked. The following question will be inherent to that particular disease or organ. If I pick gastric bypass, the question that follow up will be quite different. In this case, I would choose no previous abdominal surgery with previous biliary colic and documenting gallstones. And then I will just pretty much summarize how the procedure was accomplished by using various needles, number of trocars used. And again, the significance of that is compare my outcomes with my colleagues to reach some conclusion. Again, it's very straightforward. Again, you can play with it. Once you're done, you click or tap on page down menu. We're able to complete this procedure laparoscopically. We have no bile duct images were attempted. We found our stones and no need for colon bile duct exploration. You can see it's very comprehensive. We're able to remove all the gallbladder with no tears. We just complete this screen as I'm doing right now. And definitely I invite you just to engage yourself on these outcome programs by simply going to the SAGES website and then sign up for it.
In addition to that, I put some sheets on the front tables to pass around. If you are interested in receiving the full beta version, which includes an application to the desktop to transfer the information and be a beta tester for both Palm and Pocket PC, if you would take the sheet that's over by your left arm to the front row, and we'll pass these around. So if you want to be a beta tester for Palm or Pocket PC, both Bill Traverso, who would be very grateful for your input, George Malkin, who's the software designer, and they'll also be available in the back of the room if you want to talk to them and ask any questions. But if you want to sign up to be a beta tester for the Outcomes Initiative, there's a real opportunity right now.
Does this automatically then download the next time you look up? Does it automatically go to the...
You've got to press the button and send it to you. You've got to control
Yeah,
Not quite ready, but when the beta version is ready, if you sign up, you'll have an opportunity to see the version right out of the box. And it gives you surgeon control. You don't ever have to send your data to SAGES. It's not an automatic thing where it's going to suck data out of your computer.
But it'll keep it on your desktop and send it to SAGES.
Yes, you need a desktop application that works with it. And not only you send the data, but actually in real time you can compare your own data with the rest of colleagues importing data so you can see where you're standing. Yes?
What is this written in?
Maybe, yeah. Yeah. Again, this is it's a database engine behind the software. What you are exposed to are forms you fill out, and then the software will do the rest for you. And obviously, you've been prompted if you have any further comments that you can input. You can actually do it using the keyboard.
Does this get past the HIPAA police?
Yes, the database is HIPAA compliant, and there's what's known as a data use agreement to sign. But we've worked very hard with the outcomes committee to make these things HIPAA friendly, and there's some things to do if you want to do research on it, and all that's available if you talk to Bill and George about it.
If you use this, Bill, do you have to get IRB approval at your own institution?
Depends on how your institution handles this type of data entry that are not patient level. If you're in a big institution where everything you do, brushing your teeth in the morning has to have IRB approval, then yes. But if you're at your own practice and you don't get IRB approval for these things, then obviously no. It's sort of up to you. The database, the company, and SAGES are all HIPAA compliant with all the HIPAA regulations, and we can show you documents where you're entering it through SAGES. That's all. Once it gets there, it's all HIPAA.
The nature of the data qualifies for what is known as a limited data set, and an agreement between SAGES and you that SAGES promises not to try to identify your patients will satisfy the de-identification requirement.
Yeah, as you notice, we never entered the name of the patients or way to identify that patient.
The case number, not a patient number.
Yeah.
It's your own number that you use.
You can use your own number, make up your own list.
Exactly.
Do all fields have to be completed for the record to be accepted?
No. No, but to make things very simple, there's 13,000 cases in the database now that have been just entered by web entry. And there's about 2,500 gallbladders in there already. So if you could go online right now, you could see the averages of all these data points now, real time, depending upon the last gallbladder that have been entered. What this Palm project and Pocket PC does for satellite points, it builds a Microsoft Access database on your computer that can then download it, upload information to SAGES if you want. So it does build access database using satellite forms as a transfer from the form that's on the Pocket PC or Palm into the Microsoft database. So when you upload this into or take the CD and download it into your computer, desktop or laptop, it builds a Microsoft Access database with all these data points for all these tools. And then the next time you sync your PDA, it then puts all that stuff on your Pocket PC or Palm, and you're ready to go.
Yeah, let me finish very quickly. Once you press done here, obviously, we'll bring you up to the start menu, and you can add a new record, or you can actually enter a follow-up record. And when we do that, we'll look at, we choose gallbladder, and then we can press continue. Basically, what allows you is to update or add more information to the case you have done. I don't know if we have time just to go through, or... Okay. It's very intuitive. You can just play with it by pressing the page down button. Here, for example, on this page, you can see post-operative events. You continue, and you will be prompted. With a lot of details of that particular case until you're bring back again to the start menu or main page. advantages of using a pocket PC on this is that you don't have to be by your desktop computer doing that. You can do it while doing rounds on the fly because it's mobile.